Welcome back to continue our discussion talking about now long-acting reversible contraceptives. Joining me is Dr. Kelly Humphreys. She's in adult medicine here at Morton Comprehensive Health Services. Welcome to the program.
Well, thank you, Pam, for having me.
Now, you've been on the program before,
Yes.
and so people that may not have seen it, I want you to first, before we get into talking about the contraceptives, give our viewers an idea of adult medicine in terms of what does a physician treat, or who do you see if you're in adult medicine?
You see the full spectrum of adult males, females. It's basically a lot of internal medicine and family practice together.
Okay.
And we see the full range of ailments here at Morton's.
Okay, now how young can a person be to be considered an adult? I mean, you know, that's the other thing, to access a physician that's dealing with adult issues.
That's true. I usually will see anybody that is in puberty or above.
Okay, okay.
So,
okay, that's pretty young.
Yeah.
They think they're adults anyway, doctors,
They
so
do.
it's
They do.
good that they can transition from the pediatrician to an adult medicine physician around the ages of 13, 14. Okay, wonderful.
Well, in particular, I have an interest in women's health, and I like working with women, and I have done an OBGYN residency as well as a family practice residency, so I do a lot of the reproductive issues.
Okay.
I deal with those, and since I'm female, a lot of times women particularly feel more comfortable discussing those kinds of things with a female physician.
Okay, well, let's get into this subject because this is one that we all need to continue to know more about. What exactly is a long-acting reversible contraceptive? And then we are going to walk through different specific types. But what is that in general?
That's a type of contraception that you can use for anywhere from 3 to 10 years, and yet when it is removed, your fertility rapidly returns. And so it's not, although the products we're going to talk about today are all as good as having a tubal ligation, in other words, getting your tubes tied, and we use that in this country a lot, or a vasectomy, these three devices are readily reversible.
Okay. Now, when we talk about these devices and people think about birth control as a method to sort of plan when you're going to have children and things such as that, how do these vary in comparison to a birth control pill? Because people may think, well, the pill, if you stop using the pill, then you can have your reproductive health restored in terms of childbearing. How are these any different, really?
Well, they're a lot different, actually. Two of the three devices do have a hormone. One of the devices, Paragard, does not use hormones. But what's really unique in these is that there's such a rapid return to fertility. It usually happens within a week to a month. And particularly with the Implanon product, they had 6 total pregnancies in all the thousands of women that they looked at in the clinical trials. They think all of those pregnancies probably resulted by the women conceiving within 3 days of removal of the product.
Whoa. Okay. Now, are these particular devices, and we will start to walk through each one of them, are these pretty new on the market? Have they been around for some length of time, and the consumer in general just doesn't know about them?
That's a good question. The IUD, or Paragard, which is good for 10 years, they also call it the copper IUD, has been around the longest in this country, but we have a history, several decades worth, of various IUDs being used in the United States. We have one particular IUD that was used several decades ago that we did not have a good experience with. It's been pulled from the market now, and a lot of people remember that, and so I think it's taken a while for people to realize the newer IUDs that we have 2 of them now on the market, are very, very different from what we had in the past. The Marina IUD, which is the second IUD, was introduced in this country in 2001. However, it had been used for several years in Europe before that. The Implanon, which is an implant that goes in the arm, the upper arm, it has been around for 3 years.
Okay, okay. Well, let's start with the what we would see as the traditional, I can't remember the names you've said already, but the traditional IUD type, since maybe more people are familiar with that from past, like you said, discussions of IUDs. Walk us through that. Tell us about that. How is it used?
Well, this is the Paragard, or the
Okay.
copper T. I actually am wearing one, and this is the true size. Very small device. It has no hormone associated with it.
Okay.
It is good for 10 years. And for a female that receives this, it is very much like getting a pap smear.
Okay.
When I go to do a pap smear, I go to the cervix,
Okay,
which
hold
is
this
the
down
opening
just a little bit so
of
we
the
can see
uterus,
that. Okay.
and get some cells. And all women in this country, at least of reproductive age, should be familiar with getting a pap smear.
Right.
For someone who's had a pap smear before, putting an IUD in feels very much like getting a pap smear. It will take me a little bit longer to do,
Okay.
but not much. We go to the same area, which is the cervix, the opening of the uterus. But with an IUD, we go through the opening, and then we insert the IUD, and it stays in the lumen, or the interior of the uterus.
Okay.
The way it is shaped, and both IUDs are shaped this way, with two arms, allows it to fit very nicely and snugly in the uterus. Okay? I don't know if you can.
Now let me
hopefully
ask
see
this
that.
question, because people may wonder, with this type of insertion, sometimes we think we're going to tear or perforate something. Is there a risk of that with this, as well as tell me a little bit about the copper? People are probably picking up on that in terms of the copper. So is there a chance that we may nick ourselves or damage that area, and then do we tend to react to copper?
Well, that's a very good question. People who are allergic to copper, or people who have Wilson's disease, which is genetic and involves having too high of levels of copper in your body, should not use this product.
Okay.
However, 99.9% of us can enjoy using Paragard. The device really is very, very simple to use, and is very easily removed.
So in terms of worrying about nicking any areas and causing bleeding or setting up an infection, we don't have to worry about that.
Well, there is a very small risk,
Okay.
particularly right after placement of either IUD. One of the things the Kaiser Foundation will allow us to do is to do STD testing, or cultures for chlamydia, gonorrhea, if necessary, before we place it. Because when you place this this particular device, you actually breach a barrier going through the os, or the opening of the cervix, into the uterus. We do as close to sterile technique as possible for the implantation, and we really are very careful to make sure that patients do not have any sort of infection when we place it. However, studies have shown that the increased risk for infection only is higher for an IUD placement for the first week or two. After that, it returns to baseline, and someone who has an IUD has no greater risk of having pelvic inflammatory disease from an STD than anyone else.
Okay, we're going to take a really quick break and come back and pick up on some other insertions, contraceptive devices. Okay, please stay with us. We'll be right back.